quality isn't just about, going out and supervising to make sure things are done right. It's about being there when the caregivers and when the families need you, because, as I say to the caregivers, and it's not lost on me, sometimes I'm knocking on a door. I don't know if there's two dogs behind that door. I don't know what's going on in the home. I mean, generally, I joke with my offices, they don't send me to the toughest clients, right? When I go, I'm generally meeting with people that are really happy, but it's you're knocking on a door and you've never been on the other side before.
You're listening to Home Care Hindsight, the podcast where we talk with home care leaders about the big mistakes they've made and the even bigger lessons they've learned along the way. I'm David Knack, head of sales here at Zengage, and I've built a career on the idea that we learn a whole lot more from our mistakes than from our successes, which is great because I've made a lot of mistakes. I've gotten to know some of the leaders in this industry who've built amazing businesses and are super well respected. So I thought it'd be fun, instead of asking them about the great things they've accomplished, to have them tell the story of one of the biggest mistakes that they've made and how that mistake changed their thinking and the way they run their business. All right, welcome back to Home Care Hindsight. It's a new year. This is the first episode of 2026. I'm joined by Matt Kroll, president of personal care services at Bayada. And so, Matt, welcome to the show. Introduce yourselves for folks that aren't familiar with you.
Fantastic. Well, David, thanks for having me. As you said, my name is Matt Kroll. I lead personal care services here at Bayada Home Health Care. Been in the home care industry for 25 years now. It was 25 years in August, actually. 14 years with Bayada. Thank you. And love this industry and looking forward to talking to you today.
What's kept you in the industry for 25 years?
I always say I never knew I was going to get into this industry. I had no idea. Like a lot of people, I graduated college and didn't know what I wanted to do. And someone suggested to me, like, hey, check out this company. It's a healthcare company. Healthcare is a growing sector. And I think there were a couple things early on that hooked me. Number one, I went into a client's home in my first couple weeks. And so that was part of my orientation. And the client's home was in Pottstown, Pennsylvania. He was a veteran. And my dad was in World War II. My brother did 25 years in the Marine Corps. And I just grew up with such a massive respect for veterans. And here we were taking care of this veteran. And I sat there for about 2 hours talking to him. I thought the nurse supervisor at the time was going to kill me because we had other visits to do that day. But it just felt like such an honor and a privilege to be able to take care of people. And so I think that was kind of the initial hook. And then, the other thing that really got me was the teams that form in healthcare. I've been so privileged to be part of so many great teams throughout my career. But I think there's a closeness that comes with taking care of people because of the responsibility and the feeling of, it's not a feeling of completion. It's just a feeling of satisfaction that you get when you take care of people. And so, the teams and that experience on that first client's couch really let me know this is what I wanted to do. And I didn't have to be, it sounds naive, but I realized I didn't have to be a nurse or a doctor to make an impact in healthcare. And that was really, really cool.
Let's say you go back 25 years and you take a different fork in the road, knowing what you know now, and you don't pick home care, you don't even pick healthcare as a sector. What do you think you'd like to do?
Geez, if I went back 25 years, if you went back 25 years and asked me, I probably would have said I wanted to start my own business. I probably would have said that, I wanted to be successful. I probably would have said that I wanted to be part of a team. I grew up in a small town in Maryland, and I thought I wanted to go work on Wall Street. So I actually teach a training here at Bayada, and people say, oh, what was your path? And we do this. David Bayada and I do a little talk about, our paths in home care. And I tell people, I remember going to interviews, in New York City and also, where I went to college at the College of New Jersey. I was talking to these financial organizations. Goldman Sachs was one of them, about building relationships. And, my dad owned a small business. And I can only imagine how much these investment bankers must have been laughing at me as I was talking about the need for relationships. And, they wanted to hear about my financial prowess, which, was not my strongest suit. So yeah, I definitely did not know what I thought I wanted to do. I realized pretty quickly that was not going to be my path. Investment banking was not going to be what I was going to do. So yeah, super lucky that I found home care.
If I could wave a magic wand and make the economy reward this one thing at a really high level, the thing that I would do is build a business putting together people's like IKEA furniture. Nothing makes me happier than having a piece of furniture that has clear instructions and has all the parts you need in it, and you just need like a single screwdriver and you're good to go. Unfortunately, though, I don't think the economy is super high on that subset of. I don't, let's not call it skilled labor, right? I'm not laying bricks or anything like that, but that would be fun.
Yeah, it's what's interesting is once you put together one piece of IKEA furniture, kind of the next one just makes so much more sense. But yeah, it's kind of a brilliant business model they have for sure.
Yep. Okay. You guys, and this is kind of a good way to kick off 2026. I know we're still in December, but you guys have, I think really, set the kind of direction that the industry needs to go in as it relates to relationships with caregivers and thinking about how to reward and recognize excellent caregivers and, really build a culture around like the caregivers are the lifeblood of the business. And so, as you think about looking ahead into next year, what are some of the things that you guys have really set up as cultural markers at Bayada around how you interact with caregivers and some of the ways that you see the industry maybe still needs to catch up to the ways that we need to think about and treat and relate to our caregivers in the home care business?
I think the first thing I would say is we're going to continue to double down on recognition. I thought I knew what recognition was, and then I showed up at Bayada. And I went to our first, we call it awards weekend, but that's where we give the national heroes of the year for home health aides and for LPNs and RNs and therapists, et cetera. And so recognition is such a huge part of our culture. It's built in, the heroes ceremonies are the culmination of it, but it's really about, the daily and weekly and all the different things that we can do from a caregiver perspective to continue to recognize them. So I think it's just rinse and repeat as it relates to that. I think the other thing that's teed up for us, we've been investing a lot in caregiver wages over the past 5 or 6 years, for probably the first decade, maybe even 15 years, like the average pay rate in the industry was around $10 an hour. And it just sat right there. And it's really been on the move for the past few years. And I think we're proud of that. We feel like we've been leading that. And we see, continued investment in caregiver wages and benefits and making sure that we're doing everything we can to invest in our caregivers. And then I guess the third thing I would say is education. We have Advanced to LPN program where we offer the opportunity for them to apply to get into nursing school, and we actually scholarship them into that. And so that's one program. We have a presidential scholarship program. If they want to go on to be an RN, we can apply for them. And so I think, now that we're nonprofit and we're going to attempt to work with some grant or obtain some grants, et cetera, and really invest in advancement of our caregivers who want to go on and do more in the healthcare industry.
I have a couple of questions about points 2 and 3. The first one is, anytime we talk about caregiver wages, there's the other reality that our reimbursement is to one degree or another fairly fixed. If it's like from a private pay setting, like there's just only so much that the market will bear that people can afford in terms of home care before they start to kind of like, oh, well, I only need like 2 hours today and 3 hours, and it starts to get funky. And so how do you think, and obviously scale helps here, but like, how do you think about the balance between really investing in caregivers and paying a wage that's going to attract the best caregivers to Bayada as a destination employer, but keeping in mind, like there's margins that you guys have to hit and the business still has to run because no margin, no mission.
Let me unpack that in 2 different parts, right? So when you talk about the fixed reimbursement that we have, right, I'll start there. We realized several years ago, probably about 3 or 4 years ago, and we realized this probably 10 plus years ago in certain states, that we needed to learn to be more efficient and live at a lower margin so that we could give more of the reimbursement to our caregivers than ever before. And so we've actually, in our fixed reimbursement services, we've actually made an intentional decision to find ways to be more efficient at every level of the organization and in everything that we do so that we can invest more. And I think we're going to continue down that path as we go forward. And now with AI and with other technology and other things, we're going to continue to find ways to get more of the reimbursement to the caregivers through our own efforts to become more efficient. On the private pay side, and I guess this would bleed over into the fixed side as well, I think the hardest part for people that are buying services privately is they have a fixed asset, whether that's a couple $1,000,000, they're probably investing it conservatively, or whether it's a couple $100,000, and they don't know how long they need it. And so it's a question of, like you said, they might try to ration care. I need 2 hours here, 3 hours there. but they don't know that that could actually impact their experience or the reliability because the caregivers are trying to maximize hours. And so that's a battle, I think, no matter where price lands, because I've been saying for years, wow, the prices can't keep going up the way that they are. And they continue to go up every single year. I think people are faced with a decision. Do they want to go into institutional care? Do they want to rely on a family caregiver, or do they want to hire a caregiver? And I think I don't want to say I predict that price is going to continue to go up, but I wouldn't be surprised if price continues to go up because we're in an economy where prices are going up. Wages need to try to keep pace with that. And so I think we'll do that. Where I do think there might be some relief is where technology and we can offer other alternatives to just having a caregiver in the home. We're going to be exploring those things. We're doing some work right now where we actually are using our care documentation to score risk level of clients, and we'll titrate care up and down. And I always say home care, when you think about the cost of home care, it's the only setting where the price titrates up and down. And so if you go on vacation for a week with your family and you don't need a caregiver, you're not paying for services. If you are recovering from hip surgery and you get better and maybe you needed 10 hours a day of care, but now you can use 5, we can kind of work with you. And so I think between technology and I think the way that home care services are provided in general, we'll continue to try to be as cost effective as possible. But it's certainly, it certainly is expensive when it comes to long-term care for sure.
Yeah. Well, Matt, I appreciate you coming on the show. You're here because, you lead one of the large business units of one of the most established and well-respected brands within home care. But I brought you on this show because I bring successful people on to ask them about the big mistake that they've made in their career and how that mistake changed the way they think about life and business. So, Matt, what's your big mistake?
I think if you were to ask me, my biggest mistake, I think it was trying to do too many different things at the same time. And so for me, David, when I think about early on in my career, it was trying to do so many different services. When I was running a service office for the first time, we were doing Medicaid personal care. We were doing private pay personal care. We were doing private duty nursing and those sorts of things. And I think there's always this temptation when one of those gets challenging. Oh, I need to diversify into something else. And I think that's good at a certain size. But early on in my career, I think I was just searching for the easy way out. A referral source was hard to break into. So it's like, oh, I want to go spend my attention here. Or maybe I got a referral from a particular type of referral source. And so I wanted to focus all my energy there. And so I think what I learned is, the need to have a plan to be really good at one thing before you start trying to do multiple things is really what helped me to be successful when I was running a single office. And then ultimately when I was running multiple offices and then on down the line. So I think it's just that, it sounds super obvious, right? Like focus on one thing, but I think especially in the pressures that we're facing today where it's like, hey, there's safety and diversity. And I think that's true when it comes to diverse payer sources, but there's also risk because how each service manifests itself and what it needs and how you set up recruiting and how you set up the infrastructure to make sure you're doing it right is totally different.
It was interesting. I was chatting earlier this year with a provider in Michigan who was 100% Medicaid, and their big initiative was to diversify into a private pay mix. And one of the questions that I asked him is I said, what do you think about the much shorter length of stay that typically accompanies private pay relative to Medicaid services? And he was like, oh, I hadn't thought about that. And it's, I think there's this shiny object of the rates, reimbursement's much higher in private pay. The margins are better. And so let's go over there. And then the question is, well, how do we factor in the lifetime value of the client, all those kinds of things? And so when you think about somebody who has a good private pay business right now, and they've maybe added some VA to the mix, but they're thinking about, Medicaid rates in their state have gotten better, and so Medicaid's an easier payer to work with. What are the things that they need to kind of check off the boxes on their current footprint of, let's say, private pay and VA before they take the leap into Medicaid there?
I always say you have to start with the end in mind. And I think where mistakes happen is, you gave the example of someone who wants to jump into private pay. They kind of want to just put their toe in the water and see what happens. And they don't want to risk this other business over here, but they think they want to add that business. And so I think, do the research, work with the end in mind. How big can you grow that piece of business? What infrastructure will you need when you get to scale? And, I think you have to invest when you're caring for people. It's really hard to kind of split your resources into multiple different pieces. For us here at Bayada, actually, when we used to do everything under one roof, and inevitably one service would kind of win out and the other ones were more opportunistic, but we would end up being really big in one particular service, whether that was private duty nursing, and then the personal care would not be as big, or we were really big in personal care, but not as big in private duty nursing. And so I think it really comes down to understanding, well, what's the opportunity in your market? If you were to diversify into private pay or into Medicaid, how big do you think you could be? What infrastructure would you need to be really good at it? Because when you just dip your toe in the water, you tend not to be as good at it. And I think what we see from Medicaid providers who want to get into private pay, they don't understand the sense of urgency. They don't understand administratively managing a process where you have to dot every I and cross every T in order to get reimbursed, and you have to follow many more regulations, is much different than what I think if you talk to any private pay, small business owner or someone who works in the industry, they would tell you the pace of business is just so much faster. It's, you have to say yes when the phone rings. You figure out a way to do it. You kind of do it right then. You can't wait for all of your ducks to be in a row to do it. So yeah, it's about understanding how big do you want that piece of business to be? What's the infrastructure that you need to do it, and actually investing in that infrastructure. So if you're going to do it, you can do it right.
Makes a ton of sense. Okay. Well, I want to go to the next piece where we talk about something that's underrated in home care. It's something that's typically overlooked. You think it's way more valuable than people generally perceive.
We were talking about this prior to the podcast as well. I think we as an industry in the personal care side have to embrace that we're part of the healthcare ecosystem. And part of that means for years we referred to ourselves as non-medical, right? To stave off some of the Medicare regulations or some of the regulations that can complicate services. And I think the intention was right. But I think we need to lean in and do a better job of figuring out our impact to the overall healthcare community, developing outcomes, and holding ourselves accountable for not just the client satisfaction, not just the employee satisfaction, but what is our impact that we're making on the healthcare of the clients that we serve. We actually even stay away from the word patient, which I think is the right thing to do.
Sure.
At the same time, I do think we need to lean in, be more outcome focused, and be more accountable for the care that we're providing, and not just for the satisfaction of the care that we're providing.
What are some of the metrics that you guys are paying a lot of attention to? And I think this is kind of the other side of that question is like, we can decide what metrics we care about, but like, what are the metrics that you feel the payers really care about?
Yeah, it's interesting. It's the payers and the referral sources, David, right? You hear so many people talk about hospitalizations. That's the big one. And I think since, the Medicare certified providers and the nursing homes went to star ratings, and they're accountable for, everything from staffing ratios to hospitalizations, et cetera. It's trying to figure out some of those similar things for us. I think when we think about metrics, the things that we're looking at are falls and hospitalizations and ER visits. And so they're three separate things. And what's been interesting on our journey is, nursing homes look at those metrics and they divide by patient days. That's kind of the way that they'll say, how many times did something bad happen and over how many patient days? And can we have less bad things happen over a certain number of patient days and get better? If you look at home health, Medicare certified home health, they look at how many bad things happen within a period of, say, 30 days or 60 days or an episode of care or since they came home from the hospital. We've actually been looking into it and saying, neither of those metrics really work for us because our clients are on for a long time, but they don't necessarily receive care every single day. And so what we found is to really look at our population, we need to consider the hours of care that are provided. Someone who's receiving 24 hours of care per day is probably more likely to have an adverse event because their care is more acute. Someone who's receiving a few hours a week. And so we're actually using hours of care, and we're hoping that will be the beginning. And I'm sure there's another home care provider out there as well that's probably out there thinking about the same thing. But I think if we can look at those adverse events. Falls are the number one reason of hospitalization in people over the age of 65. And so we're really dialed into that as a primary. We track falls and falls with major injury. And so we're looking at it over the number of hours of care that are provided. We're going to draw a bell curve. We're lucky. We have 112 service offices providing personal care services and, extract best practices and then try to, obviously whatever those metrics are, try to improve them over time. And I think that will make us more marketable to the payers because we'll be able to let them know that, hey, we can keep your folks out of the hospital and keep your costs down. Your medical loss ratio can improve. And on the referral source side, we can give people the confidence to say, hey, I'm not just telling you I think Bayada is great. Here's our client satisfaction information that's actually above the industry. And here's our outcome information that we're tracking. And I think people are looking, even the clients and the family members, et cetera, we're all, if I go out to a restaurant, I go to Yelp, I go to Google reviews, et cetera, we're all looking for ways to better test a recommendation that maybe we received from a referral source or from a friend, et cetera.
This is something when I had Guy Tomasi on, he talked about early in his career, he would have his dashboard that he would take to referral sources. And he would say, you're going to have a ton of other home care providers come in, ask them for this data because they probably don't have it.
Yep.
And if they don't have it, like, how can you trust and test the things that they're saying and know whether or not it's a good referral? And I think it sounds like you guys have a different kind of dashboard that you've created that gives you a lot of confidence that the work you're doing is driving the outcomes that you're looking for. How do you go about kind of thinking about this from not just here's the data we have of what has taken place, but thinking about this in a more like proactive, like analytics oriented, predictive kind of model?
Yeah. Well, first, let me say, Guy was one of the first to start talking about this. I met him at a HCOA event and he was telling me about the great work that he did. And so totally agree, following in his footsteps and I'm sure others, and we're trying to take it to the next level. And to your point, the next level is really becoming predictive. So we know through our incident management system, how often, I can tell you how every quarter, we have X number of falls, right? For us, it's about 3,000 falls. And then we can break that down by branch. We can start to look, et cetera. What we've done is we've actually taken, David, that information. So now we have all the adverse events and we're actually linking that back up with our care documentation. So our nurses do an assessment for every client we bring on service, whether we're regulated to do so or not. Our caregivers are documenting every single shift with, what ADLs were completed. Our practice management systems are documenting whether our caregivers showed up. Did they stay the whole time? Were they late? Did someone decline a particular service? Our service offices are documenting in their client conversations. Maybe the client called in, they're not feeling well or they're in pain. So we're taking all of that information and dumping it into a large language model that AlayaCare helped us to build. And we're looking for signals within that data to say, hey, what are the things that could be signaling? Take a look at these 1,000 falls that happened. Is there anything in the data that's highly correlated with those falls? And what we found is it's not any one thing, it's a combination of things. So maybe the client's mentioning pain and they're declining an ADL, like a bathing visit, over time. Maybe it's their favorite caregiver called out and they said they didn't want a replacement. And, we missed 3 days in a row. Plus they said they're really not feeling right or whatever those combination of things are. But we're actually using that to identify risk. And every night the large language model goes in and reshuffles the risks. So our client could be medium risk and they go to high risk. They could be low risk. They go to medium risk. We're actually intervening with clients who changed risk. And then we're using our supervision and our interaction model, not based on state regulations or our own policy. We're actually interacting with clients based on their risk. We think that looking at these combination of factors, we can be more predictive. And, we've got a ton of anecdotal success stories now. We had a client who had, I think, 3 or 4 falls. And so when we weren't there, caregiver wasn't there, our nurse went out and we found out the client was getting up before our caregiver got there in the morning. And so we extended the hours, right? And so now we had more hours, the falls stopped, and it didn't lead to what previously we saw was an eventual hospitalization. Sometimes we'll work with the family, right? We're seeing things going on and, the family can juggle schedules because they have care till 5 and then no one's there from 5 to 7. And so, some different anecdotal stories of success there. Sometimes we can work with the senior living that they're living in. But we really believe that, leveraging that care documentation, and we want to begin to sprinkle in even more things into that care documentation, especially in our Medicaid population, bring in social determinants of health and other things. But really, what we hear from our teams, you often get the best anecdotes if you just listen. And so if you go out and you talk to any home care provider, us included, and you talk to the teams, they will tell you, especially the supervisors, whether it's a home health aide who's out there supervising other home health aides, or whether it's a nurse supervising, they'll say, I just wish I could spend more time with Mrs. Smith. And you say, well, why is that? Well, she needs me so much more, but I have to rush off to Mr. Jones because I got to get this form filled out every 30 days, right? You say, well, what would happen if you spent more time with Mrs. Smith? Well, we'd be able to problem solve. We'd be able to think through things. And so you get this anecdote from people that are out in the field who want to spend more time with clients who need them more. Well, now if we can provide the data to justify that, and maybe we'll go see Mr. Jones, but maybe we can see him every 60 days instead of every 30, or every 90 instead of every 60, and we can spend more time with people who have more acute needs. I think we'll be able to make a tremendous impact. And we've seen some, in an early pilot, we actually reduced hospitalizations from 11 to 8% using this risk model. We haven't been able to prove that at scale yet, but
Sure.
I feel absolutely confident that we will over time.
I have a kind of connected question here, which is you're running an organization that's got pretty significant scale, over 100 locations. I think every home care business, as they grow, realize like the ways that they used to be able to keep their finger on the pulse don't work anymore. And so what are the ways that you're able to still get those kind of anecdotes and kind of like feedback from the front line, given that like you've got a pretty large like organization that you're managing and it's like a big budget and stuff that you're probably responsible for?
Yeah, it's been quite the journey for us, right? Because I always say, even for us, if you go to one market, you've been to one market, right? Every market you go to is a bit unique. Every community has some unique needs. I think what we've done over time is to try to figure out, hey, what are the most important metrics to manage, for us? And we've actually built, our own operations dashboard. And that was a piece of it. I think for us, the real important piece, David, was building the business rhythms for how do we talk about those metrics. Private pay is a great example. You can drive yourself crazy because there's so many peaks and valleys if you, just look at things a week at a time. For instance, we look at revenue on a weekly basis. We look at census on a weekly basis. We look at new admissions on a weekly basis, et cetera. And as I travel around, I'll go to offices sometimes and they'll say, we had 2 big discharges and, our census is down, our revenue's down, and that's really what's happening. But when we would drill into the numbers, we'd say, yes, that happened, but you also haven't consistently been admitting new clients each week. And so what we found when we looked at the data is discharges over time are surprisingly predictable. If you stretch it out over a quarter, over 6 months, over a year, but there's peaks and valleys. And so what's important in the private pay business is keep the admissions consistent. And so we've really found using the data and putting the business rhythms in, there's certain things we look at weekly, certain things we look at quarterly, and then we plan annually so that we can make sure we're linking all of those things together to help make progress for us on our mission. Our mission is to serve more people. And so we want to make sure we're making progress on that over time. So it's kind of a long-winded answer. Hopefully that answered your question.
No, it's super helpful. And I think, your point about how volatile the private pay business can be is well taken. I talk to folks and everybody's had that Monday where they lose 20% of their hours because a couple of discharges happen. It can be hard to refill that bucket because those high hour cases aren't necessarily super predictable on when you get them. They kind of are nice to have come in, administratively, they're difficult to manage and you got to get a whole bunch of caregivers, build a team around them, but they're great to have. 2 of those go away and you're like, man, we just lost, $500,000 in revenue on an annualized basis. And so it's a challenging business to run.
I think the hard part is it's emotionally devastating, right? Because you work so hard, your team works. Everyone who's run a private pay business has stayed late on a Friday to put staffing together for a case. And then they get the call back that the person's going to stay in the environment they're in. They're going to stay in the rehab a couple extra days, or the grandkids are going to move in for a little bit, et cetera. And so it's just emotionally taxing. And I think, you have to sort of match that up with intellectual data to understand that, yes, there's peaks and valleys. Actually, you and I were talking about running. It's not so different from running a marathon. If you think about running 26 miles, it's completely overwhelming. if you think about running 3 to 5 days a week, it's completely manageable. And if you run 3 to 5 days a week over time, you'll be successful. I think the same is true in private pay. If you get too caught up in, oh, I lost 2 cases or I got 2 cases, you miss the point of being consistent over time. And that's where, the great home care providers in our great locations, they've embraced that journey. And I like to refer to it as embracing the chaos, because when you try to control it or you take it to heart too much, there's so many things out of our control. It can be frustrating for sure.
Makes a ton of sense. All right. We talked about a big mistake that you've made. What's a little mistake that you see other home care providers make all the time? And if they quit, it'd make their lives or their businesses like 10 times better.
Yeah, I'll probably go right back, David, to what I was just talking about. I think it's they manage too much week to week and they're not linking, long-term planning with short-term goals. They find themselves in this endless cycle of just being reactive instead of being proactive. And, the home care providers that I see and, our own offices that I see are successful, they do a fantastic job of linking those short and long-term goals. And when we have branches that struggle, or I see other home care providers that struggle, they're caught in that endless cycle of excuses and things that are going wrong, and they're not linking the short term to the long term. And trust me, there's so much that could go wrong. I don't want to say that it's easy, but it's the only way to really propel yourself forward. Even in the Medicaid business too, it's just that consistency over time in order to be successful.
Yeah. One of the things that I think often happens when you've got that kind of like short-term mentality is there's not an ability to think hard about the right bets to make and the right things to invest in. And you end up like, oh, let's try this new initiative. And then after, 15 days, it doesn't yield the results you're looking for. And so you wind that back and you try something different. You're like, oh, we're done trying new stuff because it doesn't work out. What do you think are some of the bets that when people have this kind of mentality, they're not making?
Yeah, I mean, marketing's a perfect example, right? It's like, oh, I just got a 24/7 from an assisted living. I'm going to go market to every assisted living in my marketplace. Oh, I just got a referral from a care manager. Now I'm going to focus on there. I think you kind of hit the nail on the head. The bets that people aren't making is sitting down and saying, okay, how much am I going to spend on marketing this year? And how do I make sure no matter what my revenue does, that I'm consistent in that approach? I think not enough people are betting on quality. I think quality matters. I think people assume sometimes that having someone go in and check on the care that's being provided. And sometimes the clients are saying, why do you want, I don't want anyone in my house. I just want Mary. And, it does take a village. And, boundaries can get crossed and, people can go outside their scope and those sorts of things. And so I think investing in good supervision, it helps the caregiver, it helps the client, and it helps you as an agency. And so I think it's super important and can be undervalued at times too.
I really like that. I mean, that's one of the things that we see as the biggest unlock when we're deploying our like AI scheduling agent for people is the folks aren't chained to the desk like they used to be because we're managing a bunch of the stuff like clock ins and clock outs and stuff. And the result is like, what would your good care coordinators do if they didn't have to manage all of the like EVV checks and they weren't filling call outs and scrambling? Like every single one of the agencies I talk to is like, oh, they'd be in the homes with clients and caregivers more often. And it's like, yeah, that's not going to hurt quality. Like that is going to have an impact on the like retention and the relationships that you have with all those stakeholders, because home care can be really lonely and that's a way to make it feel a lot less lonely. But also like you've got more eyeballs on who've seen, you've got caregivers who've seen a handful of clients over a long period of time, but you've got care coordinators who have seen a whole bunch of clients and how their stuff progresses and gives them just, really unique insight into how to make tweaks and improve stuff.
It makes so much difference. I'll take it all the way back to the beginning. We were talking about caregivers and pay rates, et cetera. I've been on a journey this year. I was trying to go visit a client in an office in every state where we provide services, right? So always trying to get into the client's homes to just make sure I'm not getting too far up in my ivory tower and forgetting about, what's the care that actually brings this industry to life. And one of the things that struck me when I've talked to our caregivers is more than pay rates are important, absolutely important. They want to feel supported. They want someone to be there when they call. They want someone to be there when they need help. By the way, I've been in the homes of some of the consumer directed programs where it's family members who are taking care of a loved one whose dementia is progressing and they're not sure exactly how to do it. And they want someone to be there to support them. So I think quality isn't just about, going out and supervising to make sure things are done right. It's about being there when the caregivers and when the families need you because, as I say to the caregivers, and it's not lost on me, sometimes I'm knocking on a door. I don't know if there's two dogs behind that door. I don't know what's going on in the home. I mean, generally, I joke with my offices, they don't send me to the toughest clients, right? When I go, I'm generally meeting with people that are really happy, but it's you're knocking on a door and you've never been on the other side before. And so, our caregivers, especially in home care, need our support. They need us to be there for them. The families need us to be there for them. And even though it feels intrusive and even though they might not always want us there, they need us there and we have to be there for them.
I think it's great. Okay, we talked about a lot of stuff that went wrong, but I like to end every episode on a high note. So tell me about something that's happened lately in the business that you're really proud of.
Yeah, I think I would just go back to, we actually ended up talking about it a little bit early, but it's this idea of, trying to be more predictive and use data to drive the way that we provide care. We have the privilege of taking care of clients in so many different states. I think for personal care services, we're up to 16 states where we provide services. And each one of those states has their own ideas about how to provide care. And so we've been sort of testing, is seeing clients and caregivers every 60 days good, 30 days, 90 days, those sorts of things. We've generally based that on opinions. And so what I'm really proud of is the work that we've been doing around using data to help drive the way that we're interacting with our clients and employees. We call it our enhanced quality of care model, but it's really about using that data to inform how we're interacting with our clients and being there to support them and helping to keep them where they want to be at home, and then helping to support our caregivers to give them the additional training they need. I tell families, I have friends call all the time and say, hey, Matt, my mom or dad, or they're being stubborn, or we need help, etc. And I tell them, hey, the one thing is, unfortunately, the care that they need today is not always going to be the same. And so make sure that whoever you choose, and I hope you choose Bayada, and I think we do a great job, but make sure they're going to be there with you every step of the way, because that care is not going to be the same for whatever the arc is that you're receiving the care. And you need someone who can kind of guide you. Because even those of us in the industry, I mean, I'm in the industry, and when I was faced with caring for my father who, had hospice at home, when your logic is clouded by emotion, you need someone there to guide you every step of the way. So yeah, super proud of the enhanced quality of care program. I think it's going to really set a great tone for the industry. It's been a good partnership with AlayaCare. We appreciate their support in that. And I'm hopeful that as an industry, we can embrace outcomes, we can embrace data, and we can embrace keeping clients where they want to be, which is at home.
That's good stuff. Well, before we get out of here, what do you want to plug?
I'll give a quick plug for, Bayada Home Health Care and just the great work that we're doing, and also for the Home Care Association of America. Get involved. We need more people to be involved. We need more voices at the table to make sure that, the healthcare of the future, especially our industry, personal care, is represented. So if you're not involved, get involved.
It's good stuff. Well, Matt, thank you so much for coming on the show today, rounding out 2025 with the recording and kicking off 2026 right.
David, thanks so much for having me.
On behalf of the team here at Zengage, thanks for listening to the show. We'll be back next week with another episode, so be sure to subscribe wherever you listen to podcasts on Spotify or Apple or YouTube. Leave us a rating while you're there. It helps other people find the show. If you have comments on the show, drop me a line, david@zengage.com. Would love to hear from you, chat with you there.